Measles and scabies are two distinct conditions that can impact individuals of all ages. Measles, a highly contagious viral infection, manifests as a red, blotchy rash and flu-like symptoms. Scabies, on the other hand, is an itchy skin infestation caused by a tiny mite, leading to intense itching and a pimple-like rash. While both conditions can cause discomfort, understanding their differences is crucial for proper diagnosis and treatment. Measles can be a serious illness, particularly in young children. Early diagnosis and supportive care are essential to prevent complications. Scabies, while less severe, can be highly contagious and spread rapidly through close contact. Recognizing the symptoms and seeking timely treatment can help prevent its spread. This essay will delve deeper into the causes, transmission symptoms, diagnosis and treatment of measles and scabies. By understanding these aspects, individuals can take appropriate measures to protect themselves and others from these conditions. It is important to consult a healthcare professional for any suspected case of measles or scabies for an accurate diagnosis and personalized treatment plan. Measles is caused by a virus, specifically the measles virus, which belongs to the paramyxovirus family. This highly contagious virus spreads through respiratory droplets released when an infected person coughs or sneezes. These droplets can linger in the air for up to 2 hours, making it easy for others to contract the virus. Scabies, unlike measles, is not caused by a virus but by a tiny mite known as Sarcoptes scabii. These microscopic mites burrow into the skin's outer layer to lay their eggs, causing intense itching and a rash. Scabies is primarily spread through direct skin-to-skin contact with an infected person. Transmission can also occur through contact with contaminated objects such as bedding, clothing, or towels, although this is less common. The mites can survive for a short period, about 24 to 36 hours, on surfaces, making it crucial to wash any potentially contaminated items thoroughly. Measles typically presents with a characteristic red, blotchy rash that appears a few days after the initial symptoms. The rash usually starts on the face behind the ears and then spreads to the chest, back and limbs. Other common symptoms of measles include high fever, cough, runny nose and red, watery eyes. Scabies, on the other hand, manifests as intense itching, especially at night, and a pimple-like rash. The rash can appear anywhere on the body but is commonly found on the hands, wrists, elbows, armpits, waistline and genitals. Tiny burrows created by the mites may also be visible as thin, wavy lines on the skin. The intense itching associated with scabies is due to an allergic reaction to the mite's saliva, eggs and feces. Scratching can lead to skin breakdown, increasing the risk of secondary bacterial infections. It's important to avoid scratching and seek treatment to alleviate symptoms and prevent complications. Diagnosing measles typically involves a physical examination and evaluation of the characteristic rash and other symptoms. A blood test can confirm the diagnosis by detecting measles-specific antibodies. There is no specific antiviral treatment for measles. Treatment focuses on relieving symptoms and supporting the body's immune response. This may include rest fluids, over-the-counter fever reducers, and pain relievers. A scabies diagnosis also involves a physical examination of the rash and burrows. A healthcare provider may take a skin scraping to examine under a microscope to confirm the presence of mites, eggs, or fecal matter. Scabies is treated with a topical scabicide, a medication that kills the mites. The medication, usually in the form of a cream or lotion, is applied to the entire body from the neck down and left on for the recommended duration.